there is, notwithstanding what I was saying in the last segment about some of the, in my view, government overreach that we have seen, the reality is stark when it comes to COVID-19, especially in certain parts of the country, such as the New York City area and in other heavily metropolitan areas where we do see the spread of the virus continuing, and we've seen a lot of death, a lot of tragic stories. But in the midst of tragedy, there's always something uplifting. There are good people doing good things to provide for other good people, to help those who are in need, especially in the nonprofit space when we need all the help we can get for everybody who's suffering right now. And that includes struggling healthcare workers at hospitals who need to have meals when they are working. They need to make sure that their blood sugar is at an appropriate level. They need to make sure that they're also feeling that energy that's needed to get through these very long, drawn out, and emotionally draining days. So that's why I'm so pleased to do, shall we say, a feel-good COVID-19 story that is in the midst of tragedy. There are people stepping up to help those on the front lines saving lives. Dave Weinberg handles operations at Kosher 19, which is a nonprofit organization delivering kosher meals to hospitals. And he joins us now here on Jimmy at the Crossroads. David, welcome to the show. It's good to have you.
Hi, Jimmy. How are you?
You know, I'm doing well, and I'm always encouraged when I have folks like yourself on who are really taking a tragedy and difficult time and working hard to make it better. So congratulations on what you're doing, and thanks for taking the time today.
Thanks. Happy to be here, and it's nice to have something so good to focus on during these difficult times.
Oh, it absolutely is. So I appreciate it. So first of all, tell us about the Kosher 19 organization and sort of the genesis of what you guys do and how you got to this point, the backstory in essence.
Sure, absolutely. So a little over a month ago, a good friend of mine and a reporter who you might know, Bethany Mandel, had a great idea to send folks meals, healthcare heroes, at hospitals. There had been food going out, but anyone who kept kosher, Jews especially in metropolitan areas, couldn't take advantage of any of that food because of dietary restrictions. So she tweeted out, let's help them, let's feed them, let's get out a meal tomorrow. Overnight, about $10,000 was raised, just an astonishing amount. And so she gave me a call and asked if I could help. My background is I put together a bunch of relief organizations and efforts over the years, from Darfur to helping the New York area during Hurricane Sandy. And so we built a national organization with volunteers across the country to send meals to these frontline healthcare workers. Now, kosher, but when we fulfill a request, we send to the entire unit at once. And in just over a month, we've sent over 10,000 meals to just about 200 hospital units around the country.
I think it's incredible because you found a need not just for food, but an unfilled need for food for those who are keeping kosher, which, I mean, when you have a dietary needs like that, you have to make a point of figuring out what can you do to get those needs filled in the way that you're supposed to go about it. So in terms of the challenge, I mean, how widespread was the difficulty prior to Kosher 19 stepping up and being able to provide kosher meals to hospitals for hospitals to get access to kosher meals?
Yeah, it's a great question. So there are thousands and thousands of healthcare workers across the country and around the world, probably tens of thousands, who keep kosher, and they have nothing to eat. We were hearing from them anecdotally, I'm going an entire shift, 12, 24 hours sometimes, without eating a thing. We can't have that. I mean, when I travel for events and to conferences and I can't eat, maybe I'll have a granola bar, but these are people saving lives. And some of the reason that healthcare workers on the front lines are getting sick is because they're not eating enough and they're not sleeping enough. So that's why we decided to make sure that even if there's just maybe 5 ICU doctors and staff who are keeping kosher, we want to send to all maybe 125 at once. We want to ensure that everyone's eating.
Dave Weinberg, I'm looking here at your website, kosher19.com, and then there's a hospitals page. And when you say hospitals across the country have been getting meals, you mean that. I'm looking at Missouri, New York, Massachusetts, New Jersey, Maryland, D.C., Florida. New York, by the way, is a massive state. Texas. So you literally have a presence in states all around. and you're handling operations for the organization. Tell us a little bit about what it's like being able to address the needs for people so varied across the country, because, again, we're not talking even just regional, although you do have a lot of concentration in the Northeast, such as the New York State area, but we're talking Georgia and Louisiana and Texas. What is involved in that type of a challenge to make sure that you're able to get meals to folks across the country who are in need?
Yeah, Jimmy, it's a great question. And we go back to the fundamentals of communication and systems. So we want to make sure that, one, all the volunteers who are communicating with restaurants, who are communicating with that staff of the hospital, they're communicating the same way every time. They're communicating effectively. We need to know who's going to collect the meal, how many people are in each unit, can they be there, are they going to be there, all that information. We then have our volunteers in that region reach out to a specific restaurant that we know is going to be kosher, certified, and that we've probably worked with before to set up that meal and ensure that they know exactly what they're going to be sending out, at what time, and to who. And we send them with a little thank you card also saying, people from all around the country have donated this, thank you so much, and keep safe. So it's all about systems and communication.
What kind of meals are you providing as far as how they're being made? That is to say, homemade meals, restaurants that provide kosher meals. What kinds of partnerships are you forming? Those kinds of things.
Yeah, great question. So it's sort of a three-part mission. One is to make sure that our frontline healthcare workers get fed. Two is we want to ensure that local, especially kosher restaurants, stay in business. For their location and their specific region, they may be the only restaurant for the community. And now with all this hardship happening, they're in real state of closing. And the other one is we're certainly sending folks from our community to these hospitals and healthcare facilities, and we want to let them know how important you, the healthcare worker, are to us. We want to show that gratitude. So we partnered with specifically kosher restaurants. It's not homemade. It's all done in facilities that are taking the utmost care and abiding by all the regulations possible to make sure that food is done correctly. Sometimes it's pizza, sometimes it's wraps and bagels, and sometimes it's sushi. It all depends on what the needs are of the specific hospital and unit and time. And we take that into account when we make the order.
Again, we're talking with Dave Weinberg, handling operations for Kosher 19 here on Jimmy at the Crossroads. And I think that what we're seeing across the nation right now, Dave, when it comes to the healthcare workers and the struggles that they're going through day in and day out to provide long hours, long shifts, seeing in a lot of parts of the country especially, a lot of death. We've heard very tragic reports about people having died on the way to the hospital and being removed from ambulances, and just so much difficulty that's going on. When you're interacting with hospital workers or the partners that you've got across the country, how are they responding to this? Because I bet that they must have tremendous appreciation for communities around the nation that are willing and able to give back and are stepping up to the plate.
Yeah, a big part of this is being a cheerleader for those incredible healthcare workers. And we get pictures all day long across social media of people not only thanking us, but just thanking others and what they've done. And just that little bit of moment of someone coming in and saying, thank you, right? There are times in different cities across the country where every night people go out and clap and cheer for their healthcare workers around them. Reach out to your friend who's a healthcare worker, or their family. Their family hasn't maybe seen them for days because they come home and stay in isolation. Reach out to your friends and family who have friends who are working in healthcare. Make sure they're okay. Check in with them. Get up their morale as much as possible. We need them, and we need their friends and family.
Dave, let's talk for a moment about how people can help. Look, I'm here in Colorado, for example. I don't see Colorado hospitals listed at this point. Maybe there are that aren't on the website, but I'm sure there are a lot of parts of the country where you're not in yet as far as providing the kosher meals services, as you've been working hard to do diligently. How can people across the country help and form partnerships and assist in any way that can?
Great question. We have had an onslaught of people reaching out to us, and we are doing our very best to keep up to date. Denver and the Colorado region is a good example. I have a whole bunch of follow-up calls. Denver in particular has a really strong Jewish community with folks working in the healthcare system around the Denver area, and we know also restaurants that are in need and perhaps in danger of failing. We have to get them up and running. I would say number one, just like any other relief opportunity, it's actually donations and money that are the most helpful right away because it enables us to do our work best. So if we know that we have a steady flow of cash, we can open up Denver, we can open up Los Angeles, we can open up parts of Alabama and wherever. It doesn't really matter. It's more about having a steady stream of funding. Right now, it's all grassroots. We've raised over $80,000 from nearly 1,000 donors around the country and around the world. There are no major donors. We're not soliciting anyone right now. And our partners, as of yet, are more about delivery and promotional partners.
I love it. Dave Weinberg, a few minutes left with you, and I want to ask you just sort of a more personal question relative to all this. Obviously, this is really hard work you're doing yourself, operations, along with everybody else involved in helping to make Kosher 19 function right now. What is it that drives you personally so much to make a real point of dedicating so much time to giving back to our hospital workers? What's your personal story here?
Gosh, I have a personal drive to do things that are mission focused. It derives from my own religious basis to do what's called tikkun olam, or fix the world, which is a Hebrew is tikkun olam, and part of that is giving back. And at this moment, where just like a lot of other people, I'm between things, which is the reality. And this opportunity came up that I could put my whole self and my being into doing something good that allows me every day, from the moment I wake up to the moment I go to bed, to focus on helping people. It's critical to my being and to what I do.
You know, I'm so glad you brought up the faith aspect, which is not surprising given that the organization Kosher 19 is focused on providing kosher meals to individuals who need it across the country. But in terms of this difficult time, so many people are turning to their faith for strength. What is it about your faith, Dave Weinberg, that helps you get through this difficult time, especially because knowing that you and your colleagues working hard for Kosher 19 are helping to provide the healthcare workers across the country with their needs fulfillment when it comes to food? It can't be easy in a sense of seeing and hearing what they're going through, emotionally draining. What is it about your faith that really helps to keep you motivated here?
Yeah, our faith teaches us that even in difficult times, there is a purpose and there is a reason and there is a long-term plan. And that's certainly hard to see when you're in the moment, when you're in difficulty. I remember when my father passed away and I was taking care of him, dealing with something so difficult like that, and it was years ago. You look at your faith and you see, maybe not now, but later you'll see why we did this and why we did that. And there's a purpose to our being, and there's a purpose to being a part of a greater fabric.
Very well put. Dave Weinberg, please tell us again some information on how people can get involved, your website, if they want to donate, if they want to make connections, what have you. How can they help?
Sure, the best place to go is kosher19.com, KOSHER19.com. And media, emails, and the way to get in touch with us. We'd love to be in touch with you. And again, the best way to help in this case, in this scenario, is make a donation. We really appreciate it. It enables us to send a meal to a healthcare worker at a facility around the country. Thanks so much, Jimmy.
Well, you are very welcome. Thank you for what you're doing. I do want to say, because when it was kind of weird, when you were saying the website, you were going really slowly. So I'm going to say it again, kosher19.com. That's KOSHER19.com. Shalom, Dave, and thank you so much for joining us today. Really appreciate what you're doing.
Thanks, Jimmy. Have a great day.
Thank you as well. You gotta love when people are stepping up in their communities, taking the initiative to help others in need. They see a need, they fill it, whether it's a business that you're starting or a nonprofit organization trying to provide for those in need. The goodwill and the determination, the dedication, the motivation of individual human beings underscores the point about why it's so valuable to live in a free society. Thanks for watching this clip of Jimmy at the Crossroads. Don't miss more engaging, intelligent talk. Subscribe today to the Jimmy at the Crossroads YouTube channel. You do not want to miss our live show. Thanks for your support.
I got Jimmy at the crossroads, making sense out of no sense. Yeah.